professional winger.
Yeah.
Yeah.
Don't prepare, just wing it.
I think you do better.
Okay, sir, we are,
And to remember.
Yeah.
we're now live, so if you want to take
You want to kick it
to
to relax?
relax, or we
Well, I'll introduce you.
Hello, my name is
Richards.
I am the community outreach person here at the hospital. So we would love to host more educational series on anything that you guys think you'd love to learn more about. So thank you for coming to our Medicare 101 Lunch Learn, and I want to introduce you to our hospital CEO, Brian Vogel.
Good afternoon. See, you should have winged it. As Eileen said, thank y'all for being here. Speaking for someone who is pretty close to Medicare age, it's confusing, y'all. So I'll be listening today with more intent than I did last year when we had a little session. So appreciate y'all being here. Hopefully you walk out of here with a lot of knowledge and understanding of Medicare. With that, I'll turn it over to the Gallaghers and let them go through what they do.
Thank you.
Thank y'all.
Okay, so I too want to thank you all for being here. And sometimes it's confusing, but it's not necessarily really boring. At least we don't think so. But I truly do applaud you all for taking the time to get educated and learn as much as you can. There is a lot to know. There's a lot to learn about Medicare. Sometimes people have a lot more choices and things than they actually realize. We were talking earlier, and I was sharing that about 50% of people actually take the advice of what path they should do from a neighbor or a friend that are not insurance experts or Medicare experts. So again, I really applaud you all for taking the time, because it's all about, you're going to hear this a lot today. There is not a one size fits all. You might hear from people a lot of times, well, this is the best thing to do. This is what you should do. Well, the best thing to do is really what's going to fit your lifestyle, your needs, your preferences. And so we're going to reinforce that a lot today. So I'm Stacy Gallagher, and a little teeny bit about us before we get started. I have been a registered nurse for 44 years. I still have an active license. I don't practice. I do some volunteer work for some of the hospital systems as well. I'm also a certified senior advisor. Mike has been in the health insurance industry for about 45 years. He's also a certificate holder as a National Social Security advisor. So between us, we've got a lot of experience in both of those sides of the coin, clinically, healthcare, as well as insurance. So we started our own company about 5 years ago, because when we would share our stories after work and things like that over a lot of years, we realized that we both were experiencing people with healthcare related challenges and choices to do. We're oftentimes making decisions that based on inaccurate information, not enough information, or because their son or daughter or husband told them to, that really didn't fit what they needed. So just to be really clear up front too, we are licensed insurance agents, but we do not represent an insurance company today. This is an educational only session, and we represent multiple insurance companies. We certify ourselves each and every year on a multitude of insurance companies, primarily for the reason that we're not out to sell you a particular product. We don't have quotas. We don't have anything that requires us to sell anybody anything from a particular company. So having said all that, we are based in Colorado. We live in Southwest Colorado Springs. We cover the entire state of Colorado. We're licensed in other states as well, but we primarily focus on what we do in Colorado. And again, we do cover the entire state. So hopefully after today, it's going to feel a little bit less like this. So, and Mike and I are both on Medicare as well, because we know how once you turn 65 or you're close to 65, we often hear people say, oh my gosh, I can't wait till I'm past this year so I quit getting all these mailings and things like that. Well, it won't. That's not going to happen. So just so you know, after you're 65, that's going to continue a couple times a year. We'll talk about those times too. So I'm gonna go ahead and let you get started.
Thank you, Stacy. Welcome, everyone. So today we're going to talk about, for those of you who may still be working, transitioning from being an employee to retiree. We're going to also discuss not only when to enroll in Medicare, but how do you enroll in Medicare. We're going to go into detail about the different parts of Medicare. And finally, we're going to talk about how does one fund for their health insurance and related expenses when they do retire. So Medicare is a federal program operated by our U.S. government, and it is designed to provide insurance protection for older adults, predominantly individuals 65 and above. Individuals may qualify for Medicare prior to 65 if they're disabled and have been receiving Social Security disability income benefits for 24 months. People can qualify as well as having certain diseases such as end-stage renal disease or Lou Gehrig's disease. People can qualify sooner than that. People often confuse Medicare and Medicaid. Medicaid is a joint federal and state-run program, and it's designed to provide health insurance benefits and protection for people with limited financial resources. And people need to qualify for Medicaid based on their income and their assets. Our focus today is going to be on Medicare. We do help guide people if they think that they may qualify for Medicaid, but our focus today is on Medicare. So Medicare began in 1965, and it started out with Parts A and B, and there's been changes throughout the year. There's been the introduction of Medicare Part C or Medicare Advantage plans, which we'll talk about. We're also going to talk about Medicare Part D, which is prescription drugs. So there's been constant changes throughout the years, and in your packet, there is one guide, the Medigap Purchasing Guide.
I put this, it looks like this, I put this in your packets. And this is a neutral resource. It's published by CMS, the Centers for Medicare and Medicaid Services. And a new one comes out each and every year. It usually comes out about the second quarter of the year. And what this does is it gives Medicare beneficiaries some objective information about Medicare supplement plans. You'll notice on the front it says choosing a Medigap policy. For those of you that don't know, a Medigap and a Medicare supplement are exactly the same thing. Those terms are used interchangeably. So that's what these are about. And there is Medicare Advantage plans, which we're going to talk about later. But Medigap and Medicare supplements are exactly the same thing. And that's what this booklet. And you can get this, you can order a copy of it. Again, I put one in your packets, but you can order those on Medicare.gov. You can download it or order one. Now this book, I don't know if any of you have this yet or have seen one. This comes out each year, and it usually gets in the autumn for the next year. It comes out. A lot of times it used to automatically be mailed to Medicare beneficiaries, but that's not really all that consistent anymore. But usually right before you turn 65, I encourage people to get it well before they turn 65 because there's a very, very helpful objective information in here. You can order this through Medicare.gov. You can order a print copy and they'll mail it to you. There's no charges for the print copy, or you can download one as a PDF off of their website as well, but it's extremely helpful.
So let's get started. When is one eligible for Medicare? People are eligible for Medicare on the first of the month that they turn age 65, regardless of what day your birthday falls on. If your date of birth happens to fall on the first of the month, you are eligible for Medicare the first of the month prior to the month you turn 65. Can you start Medicare when you go on Social Security? Those are two separate programs. They have different eligibility requirements. People can claim Social Security benefits prior to turning 65, and people can delay claiming Social Security benefits, after 65. So those are two different programs. If one elects to retire early, when I mean early, prior to turning age 65, you're going to need to have a plan in place as to, well, how am I going to provide for my own or dependent spouse's health insurance? So people do have separate needs, and we need to plan and prepare so that there isn't a gap in coverage. If an individual elects to work beyond age 65, and there's many of us that do so nowadays, you can delay your enrollment in Medicare as long as you have credible health insurance coverage through an employer-sponsored plan. And I use the term credible. One will not be assessed a late enrollment penalty as long as they retain credible coverage through themselves, either through their own employment or they're covered as a dependent spouse. Medicare is an individual program. There's no such thing as family coverage with Medicare. You need to qualify on your own. So if you are eligible for Medicare and you've been covering a spouse through an employer-sponsored plan, you're going to need to have a plan in place, because if the spouse is not yet eligible for Medicare, being under 65, you're going to need to have that as part of your strategy.
You might find you give a couple examples of what's considered credible and what is not.
Sure, yes. When I use the term credible health insurance coverage, that is employer-sponsored coverage that you get from the employer. Medicare does not recognize individual health insurance plans that you might get on the market exchange. They do not recognize COBRA as credible coverage. COBRA is for people that, they leave their employment, they have up to 18 months to continue coverage, paying 100% of the premium. Medicare does not recognize COBRA as credible coverage, so that's important to note. Yes. Also, the way that one enrolls in Medicare is through Social Security, SSA.gov. You can either schedule an in-person appointment. You can do it online. I recommend people doing it online. It's a lot easier, and you don't have to wait and so forth in the queues and that sort of thing. And Stacy and I often guide people with their enrollment in Medicare. I recommend that people enroll in Medicare 2 to 3 months prior to when you are eligible. It's going to take some time for Medicare to process the application. So if you're turning 65 in December of this year, now's the time to enroll in Medicare. Also, if you are claiming retirement benefits from Social Security prior to turning 65, Medicare and Social Security will automatically enroll you in Medicare. You do not have to proactively enroll yourself. However, if you're not claiming retirement benefits when you turn 65, you need to proactively enroll yourself in Medicare. It will not automatically happen. By the way, we're going to take questions at the end, but if there's something real burning that people want to ask, feel free to have us pause and we'll certainly do our best to address it. So, should I enroll in Medicare? If you are working or your spouse is working and you've got credible health insurance coverage, you're not required to enroll in Medicare. You can delay that. When you do retire, you will have a special enrollment opportunity to enroll in Medicare, and you won't be penalized or assessed a late enrollment penalty. And as I mentioned earlier, Medicare is an individual coverage. It's not family coverage. So again, if you're covering dependent spouse or children, you need to have a plan in place to make sure that there's no gap in coverage. So enrolling in Medicare Part A. Medicare Part A is the hospitalization piece of Medicare. And for most of us, Medicare Part A is going to be zero premium. As long as one has worked at least 40 quarters or 10 years and contributed into FICA and Social Security tax, Medicare is not going to charge any premium for Part A. If someone has less than 40 quarters, Medicare is going to charge a pro rata amount. Also, if you don't have 40 quarters of credit, you may be able to qualify on your spouse's work record. So that's also an option. With Medicare Part A, there's going to be deductibles and co-insurance, and we'll go into detail and describe, where are the shortfalls with Medicare. And as I mentioned earlier, if you're not claiming Social Security retirement benefits, one needs to proactively enroll in Medicare Part A. One thing that I want to mention about Part A, there is really no good reason not to enroll in Medicare Part A, even if you've got credible coverage through an employer's plan, because it's zero premium. And depending upon the size of your employer, your Medicare could be a primary payer or a secondary payer. So even if you have that credible group coverage, the one thing that's important about enrolling or choosing to enroll or not enroll in Part A is if you're making contributions to a health savings account, also known as an HSA. If you're making contributions to an HSA, you will no longer receive the tax benefit once you enroll in Medicare Parts A and or Part B. So that would be the one situation where one may want to consider delaying enrollment in Medicare Part A. So there are basically 3 timelines that people can enroll in Medicare. The first one is called your initial enrollment period. This applies to individuals who are turning age 65. Your initial enrollment period in Medicare begins, it's a 7-month window. It begins 3 months prior to the month you turn 65. It includes the month of your birth and 3 months after, where you may enroll in Medicare and not be subject to any late enrollment penalty. There's also what's called a special enrollment period. This would apply to individuals who are electing to work beyond 65 and they have credible health insurance coverage. You can delay your enrollment in Medicare, and your requirement would be that once you lose that credible coverage, either through retirement or whatever, you have up to 8 months to enroll in Medicare Part A and B and not be subject to a late enrollment penalty. If you wait longer than that, you're going to be subject to a late enrollment penalty. And the reason why you don't want to be assessed a late enrollment penalty is because once you're assessed a late enrollment penalty, it stays with you for your lifetime. So we don't want that to occur. And I can get into detail, what the penalties are, but it can be significant. So you don't want to delay. A final enrollment period is called the general enrollment period. This occurs between January 1st through March 31st of each calendar year, where one may elect to enroll in Medicare Parts A and B. However, depending upon their situation, they could be assessed the late enrollment penalty if they were without credible coverage for a specific time frame. So these are really the 3 timelines people can enroll in Medicare. And so it does give you some flexibility, and what Stacy and I try and do is help people strategize, okay, when is it appropriate, and everyone's situation is different. Enrolling in Medicare Part B. Medicare Part B is going to start on the first of the month that you turn 65, and when you enroll in Medicare Part B, you also have the opportunity to enroll in a Medicare supplement or a Medigap plan, and we'll go into that. People who have credible health insurance coverage, they may want to delay enrolling in Part B because Medicare Part B is going to charge a premium, and that premium is going to be based on one's filed tax returns 2 years prior. So that's why we often say to people, well, when should I, start planning for Medicare? Well, if you're a high wage earner, you may want to consider or at least understand what your Part B premium may be, knowing 2 years out so you can talk with your financial advisor or accountant, say, okay, how do we plan accordingly? Enrolling in Medicare Part B, you can enroll during the general enrollment period or the special enrollment period if you did not choose to enroll during your initial enrollment period. And if an important thing with Medicare Part B is that if you want to enroll in a Medicare supplement, also known as a Medigap plan, you will have what's called a guaranteed issue right, meaning the insurance company must accept your application in the Medicare supplement regardless of health status. There will be no health questions asked. That guaranteed issue right will last up to 6 months following your enrollment in Part B of Medicare. If you want to enroll in a Medicare supplement and more than 6 months has gone by that you enrolled in Part B, you're going to be subject to health questions and underwriting approval. So it's very important when we work with people to understand, okay, what is your general health overall? Are you a low or high utilizer of medical services? And understand that if you want to go down the path with the Medicare supplement, we need to do that while you've got that guaranteed issue right. Okay. I talk about Medicare Part B, what people might delay their enrollment in Part B. On this chart, you can see what the premium is going to be for Medicare Part B. And Medicare Part B premium starts at $174.70 per month. And if one is a higher wage earner, you can see on the bottom row there on the premium what your premiums are going to be. And as I mentioned a moment ago, Medicare is going to look at your tax filed income 2 years prior. So for those of you who may be turning 65 over the next few months, they're going to look at 2022 returns to determine what your Part B premium is. As your income increases or decreases during your later years, Medicare is going to adjust the premium accordingly. I will say that there is a form that Centers for Medicare and Medicaid Services has that people, if they're in a high wage earner category, maybe due to an inheritance or something, or they lost their job or they retired, there is a form where they'll recognize what I call life-changing events. And so one can apply and get reconsideration for Part B if you're in the higher category. When people are in a higher category, it's what they call IRMA surcharge, income-related monthly adjustment amount. And so for those of you who may be a high wage earner, you can see that the amount that the Medicare subsidizes is less the more that you make. Basically, that $174.70 represents 25% of the premium that Medicare would charge for Part B. So as one is a higher wage earner, that percentage decreases. So Medicare subsidizing 75%, the beneficiary is paying 25%. It's reduced. Yes, ma'am.
Okay, so the premium for $174.70, that's for 2024.
Correct.
Can we know what it is for 2025?
We won't know until around middle of November when Medicare comes out with their new charts and categories. We anticipate that there's going to be some expense. Medicare adjusts each year. It tends to be slight, but they can move those income brackets as well.
And this chart, I did put this chart in your folder.
Okay.
Okay. So I'll let Stacy talk briefly on parts A, B, C, and D.
Well, before we do that, we talked about enrollment periods, the timelines, and such. Are there any questions about any of that? If it comes to you later, you can interrupt us anytime. We want this to be helpful for you. Because right now, then, we're going to go to just a high level about what parts A, B, C, and D mean. And then individually, we're going to take each one of those pieces and do a deeper dive in terms of, what is the co-insurance, what are the co-pays, what does it cover, what does it not, and those sort of things. But if there's anything that we said prior to this that was confusing or you have any questions, just interrupt us anytime. Okay, so as Mike mentioned, Part A is hospital insurance. So think of that as any healthcare related expenses that you have that are incurred while you're an inpatient. Now that doesn't matter if it's an acute care hospital or a rehabilitation hospital. If you're in an inpatient facility, those expenses are going to fall under your coverage with Part A. And then Part B, the medical insurance, that means anything outpatient related, most things outpatient related, as well as health professional services. So your doctors. So your doctors' charges and things like that, or other health professionals, are going to fall under Part B, whether you're an inpatient or not. Any physician-related services and costs are going to fall under your coverage related to Part B. Now, Part C is Medicare Advantage plans. So we're going to talk in a lot more detail about this in just a moment, but that came along later. It wasn't part of the 1965 original Medicare, and that's why you see the term original Medicare. So in anything that you read or that you hear, if you hear the term original Medicare, they're referring strictly to Parts A and B. C is a completely different animal, and we're going to talk about that a little bit too, just so that you know the differences. Now, Part D came along later as well, so that's coverage for prescription drugs, and there's a lot to say about that. So we're going to leave that closer to the end, and I'll tell you more than you've ever wanted to know about Part D, prescription drugs, and there's a lot of things that are changing with that right now too. Okay, now this chart is also in your red folder, and I referenced all the different Part B premiums. That's on the back of this chart that you have in your packet.
Okay. I like this chart because it, I think, gives a good graphic on the different paths that people may take for their Medicare solutions. We look on the far left, we see that Medicare Part A is the hospitalization. There's going to be deductibles and coinsurance associated with Part A, and I'll go into that. And with Part A, you have the flexibility to choose any provider, doctor or hospital throughout the United States that accepts assignment of benefits from Medicare. And about 97% of providers accept assignment of benefits from Medicare. As I mentioned earlier, with Medicare Part A, that's going to be zero premium for most individuals. Next to that is Medicare Part B, which is the outpatient medical and physician services. Like Part A, there's going to be deductibles and coinsurance associated with Part A. And like Part A, you can choose any doctor throughout the United States that accepts assignment of benefits from Medicare. Unlike Part A, though, you can see at the bottom of that chart, Medicare is going to have a premium, and it starts at the $174.70. Now, people who elect to enroll in original Medicare Parts A and B, they will have the opportunity to enroll in a Medicare supplement, also known as a Medigap plan. One must be enrolled in Parts A and B in order to enroll in a Medicare supplement. These are offered by private insurance companies. You're going to pay a premium for the coverages, and there's over a dozen different Medicare supplement plans available, but they're designed to cover the deductibles and coinsurance not covered by Medicare Parts A and B. Thus was coined the name Medigap. They're filling in the gaps of what Medicare Parts A and B do not cover. The costs or premiums will vary by the plan and by the insurance company, but understand that the Medicare supplement plans have standardized benefits, meaning if you choose a Medicare supplement plan G, that plan of benefits is going to be the same regardless of the insurance company you select. Premiums may vary to some degree, but the benefits are standardized. On the far right, Medicare Part D is the prescription drug. If someone's enrolled in A and B, they're going to want to enroll in a prescription drug plan. And Stacy's going to get into detail about those plans, but they're offered by private insurance companies. And here in Colorado, there's 22 different plans available. And she's going to touch on how does one choose a Part D plan, and a lot of it's going to be contingent upon the medications one takes. In the center path, you see the Medicare Part C, also known as Medicare Advantage plans. Basically, Medicare Part C is bundling or combining hospital, medical, and prescription drug, and they're packaging it into one plan known as Medicare Part C. With these plans, there's going to be deductibles and coinsurance and copayments, and the out-of-pocket exposure can be as great as $8,850. And that applies if you're going in the network of providers that plan contracts with. All the Medicare Advantage plans are structured as network-based plans, either HMOs or PPOs, preferred provider organizations, health maintenance organizations. And so it's important that if you feel that this is the path for you, you want to make sure that the providers that you want to see or that you have a relationship are included as part of that plan. Now, with these plans, you're going to have prior authorization requirements and that sort of thing, and you're still going to be responsible for your Part B premium. So it doesn't matter which path you choose, you're going to pay the premium for Part B. Oftentimes, these Medicare Part C plans are zero or low premium. In exchange, that you need to use the doctors and hospitals that the plan contracts with, and the out-of-pocket exposure, if you're a high utilizer of these plans, can be as high as $8,850. And so when people are comparing the past, I often suggest, let's look at what out-of-pocket exposure are you comfortable with? How much, what's your risk tolerance? Are you a low utilizer or high utilizer? With a Medicare Part C plan, you may not enroll in a Medicare supplement or a Medigap plan. It is only available to those individuals who go down that first path with A and B. If you enroll in a Medicare Advantage plan and you decide, man, this isn't working for me, I want to change back to Medicare A and B with a supplement, you may do so within the first 12 months of your initial enrollment in Medicare, and you will have that guaranteed issue right for the Medicare supplement. If you want to make a change after 12 months, your application in the supplement is subject to underwriting approval, meaning there's health questions that are asked. If you enroll in a Medicare Advantage plan, you will have the opportunity to change that plan every year during the annual election period, which occurs from October 15th through December 7th. People are allowed to change from one Medicare Advantage plan to another Medicare Advantage plan during this timeline, as well as prescription drug programs if you feel you need to change your drug program, and Stacy will touch on that. So these are the paths that people can take. Once we understand which path best aligns with your needs and your values, then we can look at specific insurance carrier solutions. Now, the one thing I always suggest to people is don't just choose a plan based on your health at 65. Think about what are my health needs going to be when I'm in my 70s and 80s and beyond. And to the best of our ability, we want to fill in as much of this healthcare pie as we can with the appropriate protection. I always say to the people we meet with, let's not have a medical crisis, an unexpected medical crisis turn into a financial crisis. And so we want to have the protection. So as we go through our presentation, we're going to identify what Medicare covers in this healthcare pie and where the shortfalls are. So let's talk about Part A in a little bit more detail. This is the hospitalization piece of Medicare. With Medicare Part A, Medicare is going to cover 100% of the first 60 days that one is hospitalized. However, there is a deductible in Part A, And you can see that that deductible is $1,632. Medicare defines this as a benefit period deductible. Well, what does that mean? That means is if you're hospitalized, let's say for 3 days and then discharged, you're going to be responsible for the first $1,632 and Medicare is going to cover the balance. If you remain out of the hospital for at least 60 or more consecutive days, and later in the year you're admitted to the hospital as an inpatient again, if more than 60 days has gone by that you were out of the hospital, Medicare is going to define that as a new benefit period. Thus, one's going to pay that deductible again. So it's possible for people to pay this deductible more than one time in a calendar year. It's going to be contingent upon the frequency of admittances and the duration of time that occurs in between each hospital admittance. You can see from the chart that if someone has a very lengthy hospital stay, you're responsible for $408 per day on days 61 through 90 and $816 per day on 91 through 150. Medicare does not cover hospitalizations for stays lasting longer than 150 days. I would consider that to be an extended care. It may be a nursing home. It might be assisted living. Medicare does not get involved in extended care stays. You can see from this chart that there's potentially significant out-of-pocket exposure. That is why people will enroll in either a Medicare supplement or a Medicare Advantage plan so that they have a ceiling or a limit as to what their out-of-pocket exposure might be.
And Medicare supplement plans do cover 365 days a year for hospitals.
Correct. Yep. Another component of Part A is skilled nursing facility care. Medicare is going to cover the first 20 days in full, following a minimum 3-day inpatient stay. On days 21 through 100, the beneficiary is responsible for paying $204 per day. Medicare will cover the balance. Medicare does not cover skilled nursing care beyond 100 days. That would be, again, an extended care type of stay. So again, we have a potentially significant out-of-pocket exposure if one were enrolled in Medicare Part A only. Again, that is why people will look towards a Medicare supplement or a Medicare Advantage plan. So again, that there's a ceiling on that. A few other items that fall under Part A include blood transfusions, home health care services, and hospice. With home health care, this is skilled clinical care. This isn't personal or custodial care. And home health care clinician, they'll cover up to 35 hours per week. With hospice, if someone has a life expectancy of 6 months or less, Medicare is going to cover 95% of the hospice-related expenses. 5% is going to be the beneficiary's responsibility. So if we go back to our pie chart and we shade in red what Medicare Part A covers, we can see that there's still a lot of white on this pie chart. And a misperception that people have, they think, oh great, I'm covered by Medicare, everything's going to be covered now. Well, you'll learn after this presentation today that's not necessarily the case. I'll let Stacy touch on Part B.
Anything about Part A that people are puzzled about or have any questions about? Part A? No. Okay. Okay, so Part B are medical benefits. So again, these are going to be outpatient related costs as well as physician related costs. So this is in no way an exhausting list, but it gives you an example of some of the types of services that are going to fall under your Part B. Now, the Welcome to Medicare visit, that is considered a part of preventive services, and preventive services is a big part of Part B as well. So the Welcome to Medicare visit is a visit that you are encouraged to take advantages of during the first 12 months of your enrollment with Medicare with your primary care physician. What a lot of times is confusing to people is that they think that this is a physical. It's not a physical, it's really a consultative type of an appointment. And all preventive services, and we're going to talk a little bit more about more preventive services in a moment, are not subject to the Medicare Part B deductible, which there's one each year, and Mike will go through the costs. But preventive benefits are covered in full. The Medicare, welcome to Medicare, the first visit, again, it's consultative. And so it's going to be a review of your health history, your family health history, talking about what type of preventive services and immunizations and that sort of thing that are going to be part of your plan of care, so to speak, is what that is. So physicals by themselves, wellness physicals, aren't covered by Medicare, which really surprised me. Medicare doesn't cover those. Now, a lot of the supplements and Medicare Advantage plans do, but if you have Medicare by itself, it doesn't cover annual wellness physicals. Now, it doesn't impact any other type of physician visits and things like that with your provider, but if the assumption sometimes is if people are used to getting those before being on Medicare, that those are automatically going to be covered. So it's just something to keep in the back of your mind. Then the annual wellness visit is similar to that visit. It's another visit. There are no copays, no co-insurance associated with that, which is each and every year. Now, preventive services as a whole, these are just a few examples. So if someone and in this book, there's a much more extensive list as well as on the Medicare.gov website. So what's important to know about these for an individual, if they choose to be enrolled in Medicare A and B alone, that you want to pay attention to whatever screenings that your physician is advising that you have, because on each different screening, Medicare has its own criteria for the frequency in which it is going to be covered at 100%. And again, they do cover preventive benefits at 100%, that at a specified time frame, and each of these screenings have their own time frame in terms of the eligibility, and they will cover it in full. If you have it outside of that window, then the beneficiary is responsible for 100% of costs. Now, again, that's if you have Medicare alone. Medicare supplement plans and Medicare Advantage plans have a much richer coverage for screenings and immunizations and things like that, but it's just to be aware of if you are in Medicare alone. Any questions about the preventive benefits? Especially, we're going to go through each part of Part B in terms of like we did with Part A with the co-insurance and the co-pays and such, and what specific things it could cover. Okay.
All right. So with Medicare Part B, there is a deductible, and that deductible this year is $240, and it is a calendar year deductible, which most of us are accustomed to, not like Part A where they define it as a benefit period deductible. Once one has met their deductible, Medicare is going to cover 80% of all eligible expenses. 20% is going to be the beneficiary's responsibility. However, there's no limit on that 20% coinsurance. So whether an individual has a $1,000 medical bill or a $150,000 medical bill, you're responsible for 20%. Again, that is why people will enroll in a Medicare supplement or a Medicare Advantage plan, so that there is a cap or a ceiling on what one's out-of-pocket exposure might be. There are certain things that Medicare doesn't cover. As you can see from this list, dental and vision services, some alternative medicines, they cover chiropractic care, but there's limited numbers of visits and so forth. And so many of us, when we were working or throughout our career, we may have had the insurance protection of dental and vision and other services. One's going to need to plan, and there are individual coverages that can provide that kind of protection to people, but bear in mind that Medicare does have some restrictions on what they will not cover. So if we go back to our pie chart and we shade in red and blue what Medicare Parts A and B have, we talked about the deductibles, the co-insurance. That's why you see that there's still a lot of white space. We need to look at a prescription drug program, make sure that that's part of the package, or possibly dental protection and so forth. This area here, Medicare is not going to cover extended care type facilities. Some of you may have long-term care protection or something like that. Be aware that Medicare is not involved in that space, so people need to plan accordingly to make sure that they have as much as the healthcare pie financially that they can, and have the strategies and plans in place to have that kind of protection. So recapping Part C, basically Medicare Advantage or Medicare Part C is combining hospital, Part A, Part B medical, and prescription drug, and packaging it into one plan. There's established network providers that one needs to be aware of, and you want to utilize the providers that are in that network. Otherwise, your cost can be significantly greater. These plans can change each year, and they do. So one needs to have the due diligence that if you're enrolled in a Medicare Advantage plan, you need to take a look. Okay, is this plan changing in the following year? The insurance companies are required to provide what's called an annual notice of change letter if there's changes. You need to be aware and determine, okay, is this plan still best aligned with my needs? The out-of-pocket costs can change and so forth. The provider networks can change, and it's not necessarily the insurance company deciding who's in the network. Some providers choose to leave that particular plan, so you need to be at least cognizant of that. And then finally, if you enroll in a Medicare Part C option, you may not enroll in a Medicare supplement. It is only available to those individuals who elect to enroll in Medicare Parts A and B. I'll let Stacy touch on Part D here. There's a lot of changes next year with Part D that she'll touch on.
And on the Medicare Advantage plan, some of you may be aware of this if you've done research or if you're already on Medicare or not, that they're going to be different county by county. So like, for example, in the state of Colorado in 2024, there's something like 55 different types of Medicare Advantage plans because each insurance company has multiple plans that they offer. Some are HMOs, some are PPOs, but they're going to vary by county. So, you know, something that's available in Denver County isn't necessarily in El Paso County or is not necessarily in this county. So that's just something to be aware of too. If somebody tells you what they have and like, you need to look at this one, just know they're going to be very different county to county because there are regulations that they have in terms of what type of provider services are available in different types of communities based on the size and the location and so on. So they will be different across the state. Now, Part D, prescription drug that was added to Medicare coverage. Now, this is going to be relevant whether you're on Medicare alone, Medicare with a supplement, or Medicare with a Medicare Advantage plan. So if you're on original Medicare only, with or without a supplement, you're going to want to have prescription drug coverage, and that's going to come through Part D. If you're on a Medicare Advantage plan, the drug coverage that you have is going to be whatever Part D services are associated with that plan. You still want to do your research. If you're going to potentially go down the path of a Medicare Advantage plan, you're going to want to know what the drug coverage is. And sometimes people don't think about that. They'll look at the Medicare Advantage plans and the benefits and so on, and the added benefits and the premiums and such, which are all very important. But medication costs, especially today, you all know probably, or know somebody, that they can be astronomical sometimes. So you want to know before you pick a Medicare Advantage plan what your medication costs are going to look like with that particular plan. Okay? And then otherwise, you're going to have the choice to choose which one you want. If you're on Medicare alone or if you're on Medicare with a Medicare supplement, then you have the choice to pick any of the plans that are available that particular year. Now, Mike mentioned 22 plans. There are 22 plans available in 2024. In 2025, we only have 14. So there's a lot of things that are happening this year with the legislature, and some of you probably don't want to hear every single detail. But there's been a lot of, after the Inflation Reduction Act, there have been a lot of changes for Medicare beneficiaries that are being folded in each year. So a couple years ago, we saw insulin costs come down, or at least the cap on most insulin costs. That's the first time that's ever happened. And now this coming year, 2025, is anybody in here on Medicare already or done much research about it at all? Okay, so the coverage gap has driven everybody absolutely crazy. So those are the 4 phases of what people will end up that are associated with Part D. So there's the initial phase and then the deductible phase and then what was called the coverage gap. Years ago, it used to be called the donut hole. And then there was catastrophic coverage. And I promise you, I won't go to deep details on all those right now unless you want to hear later. But the coverage gap, there's a certain amount of what an individual has to spend as well as what the equivalent is from the benefits of drug manufacturers and the benefits of your insurance. That's what determines when somebody hits the coverage gap. Now, what's happened in past years, when somebody hit that, which this year was for $5,040, okay, then the pricing structure would change. Well, what happened is most people would end up spending more for their brand medications until they hit the next level, which was catastrophic. And then it would fall dramatically for the rest of the year. Okay, so each of these plans, it's for a year's duration. Okay, so now in 2025, the coverage gap is going away completely. Hallelujah. We're not going to have that anymore. So what's going to happen is that when people spend a certain amount of money, which this year in 2025, I'm saying this year because we've been so busy working on 2025, that there's a cap for the first time for Medicare beneficiaries. It's $2,000. So there's a cap on what a beneficiary will spend for their prescription drugs. And again, it's what you spend that are medication related. Doesn't count your premium. It doesn't count if you go get your medications from someplace outside of your plan. But anything that is a covered medication that's purchased within your plan, in addition to the equivalent of what the insurance benefits are, and if there's, in certain brands, if there's any discounts from manufacturers associated with that. If you hit $2,000, then you're done for the rest of the year. Your drugs will be covered 100%. There's not even going to be the 5% that we used to have. So this is the first year that we've experienced that. And I'm telling you this high level before I do some of the other details, is because that's one of the reasons that we're seeing only 14 plans offered this year by the insurance companies, because the insurance companies have made a lot of changes on their plan designs, resulting, because that's going to affect the profits of the insurance companies, quite frankly. So they're making a lot of adjustments too. So we have less available this year, and some of the premiums and deductibles, kind of the combination is looking very different than what we've seen it look like before. But in 2025, the premiums, they all have a premium, they all have a deductible. Premiums are monthly. They're ranging anywhere from $0 to $151 per month. And the annual deductibles are ranging anywhere from $0 to $590. Now, it used to be very similar to like an auto insurance or your home insurance, that lower premium ones had a higher deductible and vice versa. Well, it doesn't exactly look like that this year. So like always, the most important thing in picking a Part D plan, and we help anybody do this, and there's Plan Finder on Medicare.gov. It's very intuitive, it's user-friendly. The biggest thing that's going to drive what you're going to spend for your medications is what your medication list is. Now, any of you that have had Medicare coverage before, or even commercial insurance, they work very similar to that. Like, so the formulary, the drug formulary, do you all hear the words drug formulary? Those are tiers. So 2 tiers are, so 1 and 2 are generic medications, 3 and 4 are brands, 5 and 6 are specialty medications. They all have a different formula in terms of how the prices are structured. But where your medications fall into that insurance company's formulary is the biggest driver by far in terms of what plan is going to pop up as being the most beneficial for you. You can imagine how many, with the millions and millions of beneficiaries we have, and what their drug costs are. I mean, we have people that pay nothing for drugs, and we have people that spend tens of thousands of dollars a year. So, but that won't happen anymore. But that's the biggest thing that you want to look at. So your medication list, where you live, your zip code makes a difference, and then what pharmacy you want to use too. So you always want to shop at a pharmacy that is considered a preferred pharmacy with that insurance company. And it tells you that on these searches, because the pricing structure is going to be very different. Pharmacies are either going to be preferred, in-network, or out-of-network. And they all have a different pricing structure. So whatever insurance company that you end up going with, you want to know who are their preferred pharmacies in your area.
Does that include mail-in pharmacies or?
The mail order pharmacies, all of the, and again, these are all the large insurance companies, Cigna, Humana, Anthem, Aetna, the WellCare, they all have these. But every single plan will have a mail order option. Now, some insurance companies own their own mail order services, and then some contract with, there's a lot of big companies out there that that's all they do. But they will all have that as an option. And mail order is always considered a preferred pharmacy.
Oh, okay.
Mm-hmm. But on the searches that you do, like I said, we'll help you, other people that that do Part D's will help you, or on Medicare.gov. You can do a breakdown where you can see exactly per month what your estimated costs are going to be for the remainder of the year. Any questions about Part D?
I have a question.
Yes.
So I help my parents,
Mhm.
plan D. So then for 2025, the coverage gap is gonna be gone and the catastrophic, coverage is just gonna start at an earlier amount now,
At the
$2,500?
$2,000 cap this year. It'll start at the $2,000 cap.
Interesting.
And the, like on Medicare.gov, the channel finder, you'll actually see by the estimates, nobody has a crystal ball. So, all those estimates are based on what medications we're entering into the system at that particular time and what pharmacies we're looking at and so on. But once it hits $2,000, then yes, you'll go to zero.
So
In
the
terms of what-
formulary is gonna be very dependent on the formulary then, right?
Oh, yes, it's always been very dependent upon the formulary, always. But yes, this year, and on the predictions, it'll tell you if you're going to hit that and when.
An important note, that $2,000 limit that Stacy referenced, that applies only to medications that are on the plan's formulary that you're enrolled in. If you're taking a medication that is not on that plan's formulary, you're paying the cost for it. It is not going to be subject to that aggregated
It
2,000
won't
limit.
contribute to that $200, and your premiums don't contribute to the $200. And even if you buy a non-covered medication, but you buy it through your plan, sometimes even the retail price sometimes is less expensive through your plan than it is in some of the discount programs, sometimes not. You want to know. But if it's a non-covered medication and you're even purchasing it through the plan, that's still not going to count towards your $200. Oh, and the other thing, sometimes people don't want to do a Part D plan, and they're like, my medications are so inexpensive. I don't know if you know anybody like that, but we meet people like that all the time. I don't want another premium. I don't want to deal with one more thing. So I'm just going to pay for my medications. Well, like Part B, Part D has a late enrollment penalty, and the formula is different than Part D, and it doesn't sound like Part B meaning. But Part D, it doesn't sound like very much, but it accrues each month. And you never get rid of it. So it accrues every month and year after year after year. So when somebody ends up developing situations where they do have to take several prescription drug medications, they might have a penalty that's $50 a month. And that will stay with you for life on top of your premiums and everything else. So there's such a variety of plans available anymore. There are some plans where literally people don't spend anything out of pocket. So there's no good reason to not have one when it's time. Okay.
All right. I'm not going to go into detail on this, but this is just to give you an understanding that there's multiple Medicare supplement plans. Medicare defines them by a letter. This is on page 11 in that Medigap purchasing guide. And just a couple things I want to point out. The benefits are standardized. They're going to be the same regardless of which insurance company you select if you enroll in a Medicare supplement plan. The most comprehensive Medicare supplement plan that one can enroll in today is Plan G. You can see from this chart that the only item Plan G does not cover is Medicare's Part B deductible of $240. So depending upon what kind of utilizer you are of services or what kind of risk tolerance you have, this is the most comprehensive plan one can purchase. It's also going to be a more expensive plan because there's very little financial risk to the beneficiary for those that enroll in Plan G. But once we understand which path people want to go down, then we look at specific carrier solutions that offer these various plans.
As Mike said, they are, their benefits, their required benefits are regulated, so they're all the same. There might be differences with premiums and things like that amongst the different insurance companies. But there are certain benefits that insurance companies can offer that are beyond what those core benefits are that will are potentially different with different insurance companies. So doing some homework on that is always a good idea.
Okay, as we kind of wind down and wrap things up here, you can see that if you're enrolled in Medicare Parts A and B only, there's no limit on your out-of-pocket exposure. And so you want to consider either, whether it's a supplement or a Medicare Advantage plan. One thing I didn't mention earlier on, for those of you who are retired military and have TRICARE for life, TRICARE will act as your Medicare supplement. It'll be the secondary payer to Parts A and B of Medicare. So I just wanted to mention that. So what are your choices here? Well, you can enroll in original Medicare A and B. You can add a prescription drug benefit, Part D. You can combine Medicare A, B, and D with the Medicare supplement. Or finally, you can choose a Medicare Part C program. And as Stacy stated earlier, there's no one size that fits all. It doesn't, we're not saying one path is good or bad or anything like that, but it depends upon what's important to you. Is it a priority to choose your own doctors and hospitals? What's your budget? Are you a low or high utilizer of medical services? Is supplemental benefits important to you? These are all the things that we try and help people understand so that they can choose the path that best makes sense for them. And what we often say is, to the best of our ability, while we don't have a crystal ball, let's choose the plan that you think you want to be stuck in the rest of your life. If you're healthy, you may be able to make changes in the future. But if you develop some medical issues, you may be stuck in that plan. So that's what we help guide. Once one is enrolled in Medicare, they can create their own online account with their username and password and help manage your expenses and look at your claims and that sort of thing. And we certainly help guide people on this. As our focus is on Medicare optimization. We want to look at all of one's healthcare issues that they may experience during their lifetime and make sure that we've got the appropriate plans that are in place to make sure that one has the financial protection throughout their lifetime. And this is, as Stacy mentioned, this is educational. We're certainly open if people want to contact us for an individual strategy session. We're certainly open to do that. We can meet in person. We also do many virtual Zoom meetings with individuals, and we welcome the opportunity. We do not charge for any consultation. If we bring a solution to the table that the various insurance companies we represent offer, and an individual chooses to enroll, then that insurance company compensates us. But our strategy sessions, our consultations, is no obligation, no fee. It is complimentary. Want to close?
There's resources in your packet. I didn't put a whole lot in there. But if you have questions, even if you don't want a full consultation or that, or you just have some questions, or you think of something later, you can call us anytime or email us. That's absolutely fine. And I did put, if it so strikes you, there's a seminar, a feedback card in there. Mike and I do a lot of these. And so it's really important to us to make sure that we're covering things that are important to you. So if you have any constructive comments for us, positive or otherwise, we'd like to hear it because it helps us know what to change and how to develop these. So we really appreciate your time today.
Well, one last thing. We do not reach out to individuals. And so if you want to give us permission to schedule a call, then we would ask you to complete that feedback card and just indicate as such in your contact information. And either Stacy or myself will schedule a discussion with you.
And we are in the annual election period right now, as you all probably know that are on Medicare. And you will for the rest of your life be reminded. So if you have any Part D questions too, please feel free to let us know. I do.
We're going to hang out if people have personal questions that they want to ask of us. I don't know if this room is available, but.
Absolutely.
But
If I could ask a question on the Part C. I'm seeing stories, it seems like almost every day, that major hospital systems are terminating their relationship with Part C insurers. As a hospital CEO, I understand exactly why they're terminating their relationships. What happens in a community, and let's just say for I guess illustration, that Health One drops out of a Part C program in Denver. Obviously, there are other hospitals, other health systems that folks that are covered by that particular Advantage plan can go to and continue to receive health care using their Advantage plan. What would happen in a community like this one, right? We've got one hospital, and not that we're getting ready to do that, just asking a question. Because their denial rates are crazy high. And they deny after you deliver the service, and all of a sudden we're not getting paid. I'll try not to get on a soapbox and talk about insurance companies and what they're doing to the healthcare industry in total. But what happens in a community like this if we pulled out of a plan?
It's a very good point, Brian. And while there may be multiple Medicare Advantage plans and they're all trying to negotiate the contracts with the hospitals and so forth, if you're in a plan that you go to this facility and it's no longer in network, then you're either going to want to change during the annual election period with a plan that may have this hospital as a contracted provider. But yes, it's an issue. It's an issue. And, you know, we're probably close to 50-50. 50% of the people enroll in a Medicare Part C plan and about 50% in a Medicare supplement. So that may cause people to think, okay, what do I want? Am I comfortable with that network restriction or that requirement, I should say? And it's getting people to really evaluate on those.
And when a plan pulls out of a particular area, so in a situation like this, like hypothetically, if this does, you know, that plan no longer starts servicing this community and the hospital, I would assume that it's not going to service the community in general.
Right.
Then the individual ends up with what's called one of the special election periods.
Got it. Okay.
So they can change. So the individual can change to a plan that might have coverage here. So
Got
from an individual perspective, they end up with a special enrollment period. That's determined.
Okay.
So they
good.
they have the opportunity to change insurance at that time, carriers at that time.
If they leave the market.
Yeah, if they leave the market. Yes.
Oh, no. So the supplemental plans, are those like hospital agnostic then?
Yes,
They are not really
sort of,
contracted
yes.
to-
As long as the provider, hospital or physician or the provider is accepts assignment of benefits from Medicare as a participating provider, people can choose whomever they want. And Brian may know this better than I, but about 97% of providers accept assignment of benefits from Medicare.
Because what happens in those situations, Medicare is gonna pay what it pays, and then the provider is who passes it on to whoever their supplement plan is, and then the supplement pays after.
Yes.
What about pre-existing conditions?
Pre-existing condition limitations, okay. Remember I was referencing the guaranteed issue right period? People can enroll in a Medicare supplement plan during the special enrollment or initial enrollment period, and they'll have that guaranteed issue right if you go down the path with a supplement.
And guaranteed issue means that every insurance company has to take you. They can't deny you, but it has to be during those specific enrollment periods.
Right.
And what medical underwriting means, and after those have expired for an individual, then you would be subject to medical underwriting with an insurance company to be eligible for a Medicare supplement. And medical underwriting means there's a list of health questions that you have to answer. And based on how you answer them, and they have to do with with certain medications you're on. Do you have a history of this? Do you have a history of that? Have you been hospitalized for this? They're very specific questions. And depending upon how you answer those questions, the insurance company has the right to say, yes, we'll take you, or nope, you're not eligible.
But your pre-existing conditions are going to be covered during your guaranteed issue right.
Yes.
If you enroll in a Medicare Part C plan, you have a certain timeline during the annual election period that if you're in a plan and you want to change, you can change from a Medicare Advantage plan to another Medicare Advantage plan, and you will be, any pre-existing conditions are going to be covered.
Yeah.
So to say that
I've been told though, that because what I've got, there's nobody gonna take me. Except for AARP, and they're gonna be about 400.
You-
now, do you have a Medicare